Hi, everyone. Dr. Paul here from the East Ontario Health Unit, once again with a weekly update for COVID-19. Today is August 17th, 2022, and I'm going to start, as usual, by sharing my screen. In our health unit, we're now seeing a bit of a decrease as we're seeing across the province, and this is something that we had expected. In terms of hospitalizations, we're down. Really, all the parameters are down, and I'll just show them to you one by one. Our percent positivity is now starting to go on a downward trend, which is good. If we're looking at our hospitalizations there too, we're getting a downward trend. You could see here our ICU numbers are down, and so are our hospitalizations. The same goes for our institutional outbreaks. Again, you could see that we're now down to about 13 from the peak of 20. And again, I have another presentation that I'll show you kind of trends that we had from the beginning of this year. But for now, like I said, we're now looking at the tail end of wave 7. And this is something that we're seeing across the province as well. If we're looking at our wastewater, we can also see that, again, we had a bit of a peak and then downward trend for Cornwall, similar to Hawkesbury, sort of an up and down, sort of stable trend in Castleman, and again, a downward trend in the Morrisburg area as well. So to me, that is good news. If we're looking at our local statistics, I'm going to show you another slide here. A presentation that shows our trends in our health unit, and this is from May. And you could see that sort of this is the downward trend from wave 6, and then we went down and then went up again. And now you could see that we're going on a downward trend in terms of our case numbers. In terms of some of the provincial data, before I start sharing some other documents, I just wanted to show you the wastewater across the province. You've seen our wastewater locally, and you could see now that the wastewater signal really is on its way down provincially, and you can also see the numbers going down provincially across our area, particularly in the eastern area. Toronto, everything is a downward trend, with the exception of Southwest. That's now sort of leveling off. So to me, that's something that's quite important to look at. The other thing that I wanted to share with you before I talk about vaccinations is really the trends. We created a document at the health unit where we actually showed trends. I've asked my staff to look at that, and this is basically looking at trends of COVID infections and the repercussions since wave 6, which as you know peaked around April. And you could see here, I want to just show people the comparators. You see here that we had many more cases in April ending up in hospital, and you could see that sort of the ICU was always stable. And again, the hospitalizations went down and then went up again, but not to the peak levels that we had back in wave 6, where we had a lot of number of cases. And this just shows you kind of the numbers as they peaked in ICU. And you could see in April we were at 47, and we peaked here for the 7th wave at around 18. So yes, we did have another wave, but it wasn't as high. And you can see this provincially as well. This is hospitalizations. This is the higher rate of hospitalizations. And then June, and then it went down again, and then started going up again, and now in a downward trend. So this is wave 6. This is wave 7. And if, again, just to show you again our trajectory of our cases starting a wave from wave 6. By the way, we are going to be doing this for the full year and from 2020, just to look at the patterns in our area. But just to show you again, this is where we had a sort of a peak of cases around April, the wave 6, and then downward trend and an upward trend that peaked around the middle of July, and then downward trend right now, which we're looking at presently. Again, you could see as well that the percent positivity, the average, daily average, and the rolling average, again, this was at a peak here in April, went down, and then it went up again, and now starting to go down again in terms of our daily averages. So again, that's something that is encouraging and telling us that we are on the other side of the curve in terms of that. And you could see as well, sort of we had the remnants in May here. We had higher peaks in April, but again, you can see the remnants of the water in all our 4 areas, where you can see that we had an upward trend. I started around July, here, which is coincident after July 1st and so on, and then it kind of now is going downwards and stabilizing. So to me, those are important indicators that we have. Again, outbreaks. We had a lot of outbreaks in April. As you could see, it went down and then it went up and then down again. And one of the things that I've said time and time again is that with these outbreaks, we have residents that get infected, but very minimal hospitalizations and deaths in that. So to me, that just shows us that we're really on the way down. I'm going to now just I want to share a few other, I'm going to go back to vaccines actually. So I'm going to now just look at our vaccination rates, because I want to talk a bit about that and what's new as we move forward. So in terms of our vaccinations, I'm going to just share this slide here, which basically shows us our data. And again, if we're looking at our vaccines administered, I just again want to stress that we're starting to increase slowly but surely in terms of fourth dose among the population, the elderly population, and again, third dose is really down, particularly in the younger individuals. And again, I encourage everybody to get their third dose because the third dose makes a big difference between second and third dose. And of course, people who are due for their fourth dose should be getting the fourth dose. And in particular, if you're wondering if you need a fourth dose or not, really, it's depending on your vulnerability and people around you. If you're living with high risk individuals, perhaps you should be protected more. Our goal, again, at this point in time, is to be able to very importantly, decrease hospitalization and severe disease, which we have. And this is a testament to the fourth dose, is the fact that we've had many hundreds of cases of residents among our congregate care settings, but we've had minimal hospitalizations and minimal death, if any. So we've had a couple, but again, very low. And individuals who have been dying are usually the elderly and very fragile with underlying medical conditions. And that's tragic. But again, this is a completely different picture of when we had outbreaks before the vaccine, where we definitely had deaths, definitely had admissions from these, which we don't right now with the fourth dose. So to me, the message really is, how are we going to plan and what's going to happen over the next couple of months as we enter school, at the end of this month into the early September. So I just wanted to share a few things in terms of what we're expecting. I want to start first with the vaccinations and say that, again, if you are due for your third dose, please go and get it. I know that there's questions about, well, shall we wait for the new bivalent vaccination? And the bivalent one is going to be a new vaccination. Well, it's going to be a vaccine that has the old version of the vaccine in it, but also the Omicron version. It'll have much better protection against getting Omicron in the first place. And I want to just clarify that these vaccines, the bivalent vaccine, it will continue. And I just want to stress that it will continue to protect from severe disease. And because it's got the Omicron variant, it'll actually be better at preventing you from getting the infection in the first place. And that's what we had initially with the vaccine when we rolled it out. But when it mutated, the Omicron became resistant in terms of being transmission. But fortunately, the vaccines, and if we continue with being up to date with the vaccines, the original version of the vaccine prevents significant disease and death, no question about it. And so that's what our goal is, to be able to prevent those. So if you're at risk individual, the additional protection really from getting it in the first place, but if you need your dose right now, I don't think you should probably get it now, and then we could booster you in the fall for the other one. But I just want to stress that the vaccines are effective for what we are targeting at this point in time, which is the individuals that are above 60, particularly above 70, who are the ones that are succumbing to severe disease, being hospitalized. So that's important. Again, and then the next dose, the bivalent one, which likely will be available in the fall sometime, will replace the current vaccine and will be your next booster. So again, it depends on your situation. People are asking me, should I get my third dose? Should I get my fourth dose? Personally, if I were you, if you're a long ways after your second dose, you have minimal protection. Third dose would help you right now, and then 4 to 8 weeks later, you can get your next dose when the bivalent comes out. We're not sure when it's going to come out. But again, I just want to stress that if you do get vaccinated right now, and you're due for your second or third dose or fourth dose, it'll increase your protection a bit against getting the infection, but a lot against severe disease, which is what we want to prevent. So again, it depends on individualized situation. Now, the new Omicron variant containing vaccine, the bivalent means that it's got two strains, which is the original strain and the Omicron strain in it. It's not uncommon. The flu vaccine typically has 3 or 4 strains in it. So it's not uncommon to have multiple strains. And so it's called the trivalent if it's 3, quadrivalent if it's 4, and so on. This one will have two variants, two strains, one which was the original formulation, and the other one will be the Omicron one as well, which was initially resistant to the original version. Again, resistant for transmission, but effective. The vaccines were still effective against preventing disease. So as we come into the fall, I believe that the bivalent vaccine will replace the typical vaccine that we have and will offer that additional protection. That additional protection into continuing to protect against severe disease will also prevent you from getting the disease in the first place. And that's the key, in my opinion, where we can really control the pandemic. Because if the virus is prevented from transmitting in the community, so let's say have the bivalent vaccine, and even though they're exposed, they don't get it, and they can't transmit it. At that point, the virus will have little chance of surviving, and so we'll be seeing sort of a closer to the end of the pandemic. And that's what I'm looking forward to moving forward. I do realize that everybody is fed up of me talking about vaccinations, public health measures, and by the way, masking is still recommended for indoor settings and outdoor crowded settings, again, depending on your situation and your comfort and your vulnerability or the vulnerability of people around you. But one of the things that we're going to be moving forward with is really looking at rolling out the vaccine. And by the way, the health unit here, our region, has reached the 500,000 milestone. As of yesterday, we had over 500,000 vaccines administered to our population, and that most of those were delivered directly or indirectly by our health unit, but in combination with a lot of other partners, primary care, EMS partners, hospitals, as well as pharmacies, which I thank them all, and I thank the community for stepping up. 500,000 is a milestone, but we need to continue, and again, for the reasons that I explained to you before. So if you are in the category where you can't wait for the bivalent in the fall, I would recommend you get your next dose. If you're in a situation where you've just been recently infected, you need to wait 3 months anyway, or you don't have any risk factors and you don't live with people who have risk factors, then you could likely wait, because again, we're talking within a month, within probably 4 to 6 weeks. And again, I don't know. It depends on when this is going to be approved by Health Canada. My feeling is it's going to be sometime in September. Again, I don't know, but that's what we're looking at. We are preparing for a rollout of that vaccine. We are preparing to support our schools go back to school. I do believe that it's important for the kids to go back to school as normal as possible. As a pediatrician, I can tell you that I believe that the risk of closing down and doing all these restrictions in schools is probably higher than the risk of COVID at this point. Although again, we need to do our best to vaccinate everybody and use the other layers of protection as well. For children as well, we've had a low uptake of 0 to 6 months to 5-year-old vaccine, but it's increasing. And so again, important to note as well that it seems that vaccination also prevents against complications of COVID in young children. Some recent studies came out in that regard. So again, thank you very much for all you do. Don't forget, we're also going to be planning for a flu season coming in the fall. So a lot of work and preparation has gone into it. But I do believe that 2023. Again, I'm not a betting man, but perhaps would be the beginning of the end of the pandemic. But we still have another couple of months, but we do have tools. Now we have the bivalent vaccine. We have antivirals that will have a lot of information about who can get antivirals, where they can get them. That we're working on right now with our partners. So all those tools in place make us make me more confident that we'll be able to withstand, any little wave. Like if you saw, and that's what we predicted, we'd get little waves up and down, that will not overcome our system, overwhelm our system. I just want to also say as well that another important issue dealing with the Omicron vaccine, the bivalent vaccine, is that right now, of course, we're preventing severe disease in a lot of people, deaths with a vaccination, but we're not preventing at a high enough rate transmission of the virus from one person to another, despite them being vaccinated. And that's what's causing a lot of people to stay home from work, and particularly putting a stress on our healthcare system. So as that gets better, I think the healthcare system will have a bit more fluidity. However, one of the other reasons that it's important to have a vaccine that prevents people from getting the infection in the first place is to be able to preserve our workforce, be it, and importantly, the healthcare, but other workforces as well. As you know, when you have an infection, you have to stay home, or when your kids are infected, have to stay home. So another reason that I'm excited about the bivalent vaccine is that is going to offer that prevention as well. So once again, thank you all for all your cooperation, and I'll see you next week.